Participation Subcommittee of the South Australian Maternal and Perinatal Mortality Committee. Welcome to the 2016 Perinatal Forum, which happens to be the 20th consecutive year and the 10th to be titled the annual Dr. Brian Pridmore Perinatal Forum. So I'm Aimee Wiltshire. I'm one of the O&G consultants who works at Women's and Children's, but not currently, and hopefully won't do anything right this second either. So firstly, we would like to acknowledge this land that we meet on today is the traditional lands for the Kaurna people, and that we respect their spiritual relationship with the country. We also acknowledge that the Kaurna people as the custodians of the Adelaide region and that their cultural and heritage beliefs are still as important to the living Kaurna people today. So it's great to see so many people here tonight. We're very grateful for the assistance provided through the University of Adelaide in allowing this, allowing us to use this venue. It's the second year we've been able to do this, and it's certainly overcome some of our spatial and audiovisual challenges we've had in previous years, which is fantastic. It's also great to be able to have the filming of the forum again this year, as we've done for the last few years. The edited version of the forum is placed on the SA Health website, and this allows our colleagues who are not necessarily able to get here at the time to be able to have access to this event. And so we want to keep this function going, and so it does depend on the number of hits. And so please use it yourself or encourage people to use it. And so you can find it through sahealth.sa.gov.au, going into clinical resources, down to the perinatal section of the clinical topics part, and you'll see it there as a separate heading. And certainly there's the last couple of years are up there for your perusal at the moment. Other things to think about, so your feedback is vital and would really appreciate completion of the forms that are going to be down here at the front at the end of the evening to just complete and then hand it back to us. Certainly helps us in preparation for the next year's forum, and certainly we can pick topics based on that, but also we take on board what people say, which is great. So we'd like to commend Robin Canare and Dr. Wendy Shield from the Pregnancy Outcome Unit for all the hard work they do in helping to bring all the components of these events together. And of course, Dr. Brian Wheatley and Dr. Mojgan Vatani. You'll hear from Vanish a bit later tonight as one of our experts. And of course, Mojgan Vatani is our new leader. As a subcommittee of the main Maternal and Perinatal Mortality Committee, we're also requested to each year bring to your attention the latest recommendations that will appear in the most recent annual report. And so these are coming from the 2014 report. There aren't very many recommendations in that calendar year, but the first, when a pregnant rhesus negative woman has vaginal bleeding, fetal-maternal hemorrhage should be quantified to determine the dose of anti-D to be administered. And from previous years highlighted by deaths in 2014, urgent medical advice should be sought for all infants who are excessively drowsy and or are feeding poorly and not gaining weight. So that completes the recommendations, and I'm going to hand over to Dr. Mojgan Vatani now to take over the next part of the evening.
Well, I'm going to be very short. I'm Mojgan Vatani. I'm also one of the O&G specialists at Women and Children, and very nice to see so many people here. Now, for people who have been here just in recent years, the venue has changed, so we go through the mock case scenarios, and then we present the case and we ask our experts to come and give us a talk, and it will be a time at the end of the talk to ask questions, and then at the end we ask all the experts come here and also ask more questions. So it's very important to please ask as many questions you want to at the end, and is also we really would like to your participation, which has been one of the very good strengths of this meeting.